name is Bradley Childers, and I'm going to be performing a musculoskeletal and neurological exam today on Austin. First thing I'm going to do is palpate her radial and brachial pulses. Make sure they're even on both sides. And her radial pulses are. I'm going to check her brachial pulses on each side. And they look good. I'm going to have her squeeze my fingers to test her hand strength, and it's strong. I'm going to have her close her hand. Don't let me open your hand when. Okay, that's good. And that's good. I'm going to check the range of motion of her hands. Can you spread your fingers up and close them? Okay. You put your wrists up and down, and kind of side to side, and rotate them. All right, good deal. Now we're going to assess the range of motion of your arms. Can you put your arms straight up? It'd probably be best if you could stand for me, if you don't mind. So just arms straight up, and then out to the side, and then down at your sides, straight out in front of you, and then try and go back as far as you can. And then act like you're trying to scratch your back, and then do that with the other arm too. And then pull your arm back behind you like you're trying to scratch the middle of your back, and then do it with the other arm, and that looks good. She has full range of motion with her arms. And now we're going to look at her shoulders. You can shrug your shoulders up for me and push against me. Good shoulder strength. Can you pull your shoulders back? Good. Pull them kind of forward, shrug. There you go. Good. Everything looked symmetrical. There wasn't any popping. Did you have any pain with any of that movement?
Nope.
Okay. So now I'm going to look at her lower extremities. Her lower extremities look even. When she was standing, both of her feet were equally on the ground. Looked like she was carrying her weight evenly between her 2 feet. I'm going to assess her skin real quick. Skin looks nice and intact. There's no swelling, there's no varicose veins, no bruising. Everything looks good there. It's hard to tell her hair distribution just because her legs are shaved, so that'd probably be more of a male assessment there. Now I'm going to check her pulses. I'm going to check her popliteal pulses on each leg. Make sure they're even. Make sure one's not weaker than the other. And those feel good. And I'm going to do the posterior tibial pulses. And those are good. And the dorsalis pedis. And those are good as well. Now I'm going to ask Austin if she'll stand up again and lay down on the floor so we can test range of motion of her hips, knees, ankles, and feet. So Austin, if you can just kind of raise your legs up off the ground, and
Both of them?
we'll just do one at a time. And we'll bend your knee. Do you have any pain there in your hip?
No.
Any popping?
Mm-mm.
No? Okay. And we'll do that with the other leg too. Just kind of bend it up. No popping or anything with that. Alright, can you just raise one leg up as high as you can? Okay, good job. And we'll do the other one as you can. Okay, good job. Alright, now, can I have you flip the other way so we can see your ankles a little bit better in the video?
This way?
No,
Okay.
sideways, and kind of scoot back a little bit.
Back here?
Not that way. There you go. So we're going to assess each ankle. Can you pull your toes back towards you and then push down and kind of circular motion with your ankle? Any pain or popping with that? And with this one, any pain or popping with that? No? Okay. You go ahead and stand up for me. Now we're going to assess her knees. We're going to do a deep knee bend test. If you can, just kind of and do a squat for me until you go to 90 degrees. A little far.
Degrees.
Well, that was good. any popping or pain with that? Okay. I assessed her knees and ankles when I lifted up her pant leg, and there didn't appear to be any swelling. She doesn't report any pain with any of that. So now I'm going to take a look at her spine. Let's see, I'm going to have you sit down in this chair for me, facing the camera. If you could bend forward for me. Alright, your spine looks nice and even. Go ahead and sit back for me. You've got a nice S shape of her spine. I don't see any scoliosis or kyphosis. Let me twist this chair around for you. Okay, go ahead and sit down. And so you can bend forward. Any pain or popping with that?
No.
Can you kind of arch your back? Any pain or popping with that? Lean to each side. Any difficulty there? No? Okay. All right, go ahead and stand up for me one more time. And what I'm going to have you do is walk towards me as much as you can. We're going to assess her gait here, make sure it's a nice, even, steady gait. She's not tripping over her feet or dragging it. And that looks good. And if you can come back towards me and turn around and walk the other way. There you go. Everything looks nice and symmetrical. Her hips are even. Shoulders are even. So now we're going to do a Romberg test. What we're going to do is I'm going to have you close your eyes and hold your arms out in front of you. We're looking for any drift. And that looks good there. She's holding her arms nice and even. Now we'll have you take a seat once more. We're going to do a Babinski reflex. It'll be on your foot. And this may be kind of ticklish here. Alright, she has a good reflex with that. Alrighty. No, you're fine. Okay, so now we're going to do the rapid alternation of movements. If you can, just touch each finger to your thumb individually. Keep doing that. And she looks good with that. Nice fluid movement. She's not having any difficulty with that. Now, if you can, close your eyes, and you're going to extend your arms out and touch one hand to your nose and then the other as well. And do that 2 more times for me. Alright, good deal. Alright, so now we're going to do the heel down the shin test. If you can, just take your heel and rub it down your shin. Okay, that looks good. And she's following her shin nicely there. Alrighty, so now I'm going to do the position sense of fingers. Alright. So position sense of fingers.